Mitchell, and I will be discussing why we should not be fearful of the coronavirus. From October 1st, 2019 to March 28th, 2020, 55 million U.S. citizens contracted a deadly virus. The question is, which virus? Take a guess. I'll give you a second. Nope, not the coronavirus, but in fact the influenza, the normal flu that we get in cold and flu season. On the contrary, only 330,891 U.S. citizens have contracted COVID-19 since January 22nd of this year. This makes me ask, should everyone freak out on this big of a wide scale if it's not as catastrophic as the flu? I believe everyone shouldn't, and I will tell you why. The first reason we shouldn't be freaking out about the coronavirus is that many people who contract the virus have a mild illness and are able to recover at home. For example, Johns Hopkins University has a COVID-19 recovery tracker, which has 202,000 recoveries to this day and counting. Now, however, people with weaker immune systems or bad health problems and older age will be more affected by the disease and be at risk, but this doesn't mean we should panic for our lives. Even if you are older or have health issues, you should not panic. For example, there are many older people with health issues recovering from COVID-19. One 95-year-old grandmother in Italy is the oldest patient so far to recover. The more shocking thing about her recovery is that she recovered with any antiviral therapy, and it all happened in 9 days. Another example is the majority only develop symptoms of a cough and fever. We should merely be cautious and be smart about our decisions while following the guidelines set by the CDC. The second reason we should not panic is because there is a dangerous line when it comes to knowing the existence of something with not having much knowledge about it. For example, in the beginning before COVID-19 was made aware, many doctors only assumed patients had a false negative for the flu or a respiratory disease. The first case of COVID-19 reported to the WHO was a pneumonia of unknown cause on December 31st, 2019. Now, during this time, everyone remained calm, but once COVID-19's whereabouts were reported to the public, many people exaggerated their experiences and the negatives to one another about the disease. When this occurred, many people didn't know the true facts of COVID-19 and reacted before finding out the truth. And my advice is to search for facts on reliable and credible websites such as the CDC.org or WHO.int. Lastly, the media has a large influence on our lives today. Social media is a place that we all go to relax, check on everyone else's lives, or in most cases, post our own. However, during a time like this, the media is somewhere where you do not want to fall into. Unfortunately, the media is also vulnerable, allowing people to post anything they would like without having reputable sources. Many of our fears of the coronavirus stem from false information. This causes chaos in our communities because they act on their beliefs. For example, personally, I've seen on my own Facebook people claiming if they go out, the police will find them for doing so. And my own mother even told me that I shouldn't be going out at night because I might get pulled over based on these accusations online. Other people like myself are too scared to go out to these essential places like to get medication or to get groceries without being scared to be pulled over. And another story is a televangelist, Pastor Jim Baker. He televised that colloidal silver will cure the coronavirus in 12 hours, and he was selling this himself just to make a profit out of it. And he used people's fears just to feed on his money. So basically, he made a profit from people's fears and their gullibleness. So please make sure you find out the truth about the facts that you see on the internet. Obviously, the colloidal silver was debunked by the FTC and FDA. Lastly, another is claiming the coronavirus gets worse after taking anti-inflammatory drugs. but the FDA only advises on not using steroid anti-inflammatory drugs, not every single anti-inflammatory drug. Now, because of this claim that everyone has, everyone's refusing to buy anti-inflammatory drugs during a time like allergy season, which is ridiculous. US Today informs readers that experts recommend limiting their exposure to social media. If we believe these false claims, then communities will act toward them, resulting in even more anxiety and fear. It'll be like a domino effect. In conclusion,